back, latest hour. We're talking about plastic surgery and the cosmetic surgery, and we have some new information, if I can say, that carbon dioxide would help reduce or make the dark circles around your eye disappear. And if you really want to know how, you can watch the replay of our episode because we've already discussed this. Dr. Fatima, I want to ask about the qualified plastic surgeons, yes, or cosmetic surgeons. We've been reading, and this obviously occasionally happens, or frequently, per month or every 2 months, you read an article about someone who said that I'm a specialist in the cosmetic plastic surgery, and he's not or she's not, after they've done disasters, actually, yes, not only mistakes to patients. How to choose one?
So as a patient, when you go to any plastic surgery clinic, so you have to know exactly where are you going. So you can ask before going to that clinic. Probably you can Google it if it is in Google, or ask other physicians or other people might know the plastic surgeon or the good plastic surgeon or qualified plastic surgeon in the area. So how we can say this plastic surgeon is qualified? So they have to be trained as a plastic surgeon and certified to be a plastic surgeon. And here we are lucky to have Saudi Council, so all these plastic surgeon who's registered as a specialist or consultant plastic surgeon from the Saudi Council, they are a qualified plastic surgeon.
Actually, I have to admit that in these cases, it doesn't take place in the Kingdom of Saudi Arabia.
Yeah,
I've never heard about one here.
Yeah.
But in neighboring countries,
yes,
United Arab Emirates, I've heard some, and other countries I've heard also some.
Yes. Yeah, we are lucky so far that we didn't have this issue. So this is the main thing that you have to ask, and you can ask the physician directly, where did you get your training? Are you certified? Where did you do your specialization?
I guess any physician, how they are going to receive these questions?
Probably they will not take it so easy, but it's your right to ask.
It's my right to...
Yes, it's your right. If you couldn't answer this question before coming to the clinic, you can ask. And the good and the qualified surgeon, they shouldn't, feel off of this.
They should be confident enough to know that it's
to answer the
right for the patient, and they just want to feel calm.
Yeah, exactly. Or you can ask the reception before you're coming into the clinic, or the appointments people, or the hospital themselves. And the good place, the well-known place, like known hospitals, known names, so they are really, they wouldn't hire people.
They would not risk their reputation that they struggled for years to build it. So of course,
it's very important to choose the place and the physician.
The permanent fillers.
Yes.
These days we are hearing a lot about the permanent fillers. They are cheap and easy, and they are not over the counter, but you find some people who are not specialists, and they mentioned that they are sort of, they are well trained, and this is something that doesn't really require that you should be a graduate from the medical school to perform it.
Yeah, it has to be, I think it has to be a cosmetic surgeon, either plastic surgeon or dermatology, physician, or cosmetic, cosmetic surgeon in general, and they are really qualified and they know exactly what they are doing. Permanent filler is a big issue, and always it's been an issue for us, the plastic surgeon, because we have to deal with the complication comes after injecting this material. They are cheap and they are permanent, and that's what the people are looking for, something permanent.
So the common fillers are not permanent. You have
most
to
of the they are temporary. Refill them, like 6 months, 9 months, some of them like 18 months. So the permanent one, which they has to stay for longer period, like 2 years, 5 years, or forever. But they have a lot of complications.
Like what?
Like skin infections, collections, granulomas, disfigurement.
You don't recommend them?
No.
Even
I just warn the patient.
Plastic surgeon. Even if a plastic surgeon is going to perform that, you don't recommend the permanent
I don't recommend
fillers.
Personally, and I think most of my colleagues agree with that, because we have been suffering from these materials. It came like a trend in the last, let's say, 4 or 5 years. It came from outside, but we've been suffering with all the complications the patient they had, from other physicians.
Yes.
Or probably non-physician.
Yes, yes, most of the time. I guess only peeling
Yeah.
you can do under someone who is not a medical school graduate.
Right.
Only. This is the maximum. But anything deeper than peeling,
Right.
it should be done by the hands of a specialist.
Yes.
The cosmetic surgery and plastic surgery, they have done a lot for people who suffered from burns, different degrees,
Yes.
and the reconstructive skin taken from one part of the body to be put in another part. Tell me about a case that was really strange or something that you faced along your experience and you cannot forget.
Yeah. I think most of the burn patients, especially in children, this is unforgettable. When they come with a high percentage of burn, like 90% or 100%, and they end with, mortality is very high in these patients. So when they survive from this procedure, they end with, a huge disfigurement of their body.
Do you have any idea, Dr. Fatima, the reason behind that? Why could they be exposed to something like this?
Well, accidents happen, like, everywhere, like in winter, like when they put the fireplace and they don't watch the children.
Watching the children is the issue, actually.
Yes, yeah.
Watch your child.
Children in the kitchen while the mother is cooking, or she left the kitchen, supervision, yeah, it happens. It happens all the time, and it ends with disasters. So mothers in the houses has to be careful.
Yeah. Or whomever is going to take care of
anybody
they
supervising
should supervise.
the children, yes.
You've been mentioning that you faced a child and he was 90%?
Yeah. Yes. 90 or 70. Any burn above 70%, they struggle a lot in the intensive care before they can survive this injury.
And what does plastic surgery or cosmetic surgery?
Okay, we treat them from the beginning because they have a lot of wounds covering all their bodies, so this body surface is exposed. They are losing out fluid. There is, electrolyte imbalance, and some of them they cannot breathe because of inhalation burns and all this disturbance. So they need an intensive care for a longer period. If they survive that and they went with the ICU care, these burn wounds has to be covered. So what we do is a burn reconstruction, and most of the time we do grafting, skin grafting, and you have to borrow the skin from what is saved in their body, and if they are 90%, you don't have that much of skin to cover what they have. So here is the struggle come. Yeah.
And do you take parts from other people?
No, you cannot, because because they will have rejection. So you cannot transplant any organ. Skin is an organ to another,
But
patient.
it's common, Dr. Fatima, that the people in countries where you can donate your organs, your body organs after dying, that skin is one of them.
But you have to do a lot of compatibility between them, and they have to, to be compatible with this patient's skin.
So it's like an organ.
It's like an organ, and in the emergencies, you cannot risk any more immune reaction in these patients.
Especially if it's 90%.
If he's burned and he's sick and he's in ICU, it's very difficult. Yeah, but we have other temporary options for addressing that we can use till they, use the skin graft which is available and it heals. Then we go back again and we use it. So it is more very complicated issue, but this is a big role that plastic surgeon they do.
Yeah.
Plastic cosmetics.
Dr. Fatima Alsubhi, the consultant plastic surgeon, thanks a lot for being here with us and for all what you mentioned.
Yeah.
If you didn't follow our episode from its beginning, you can watch the replay 11:30 p.m. Makkah Mukarramah time, 8:30 p.m. GMT. Welcome back. Latest hour, we're talking about plastic surgery and the cosmetic surgery, and we have some new information, if I can say, that carbon dioxide would help reduce or make the dark circles around your eye disappear. And if you really want to know how, you can watch the replay of our episode because we've already discussed this. Dr. Fatima, I want to ask about the qualified plastic surgeons or cosmetic surgeons. We've been reading, and this obviously occasionally happens or frequently, per month or every 2 months you read an article about someone who said that I'm a specialist in the cosmetic plastic surgery, and he's not or she's not, after they've done disasters actually.